Hello everyone and welcome back to Code Rhetoric with Tam Talk. We have a haul, and as you can see I've already opened it, and I want to go through it with you, or open the package. Well, I've already opened the package, but I want to go through it with you, do a little unveiling or opening of an Amazon haul. This particularly Welcome back to another Code Rhetoric episode. This is your girl Tam Talk, and on today's video I want to talk about digital health. Technology is increasingly and rapidly invading the healthcare space, so I want to talk to you on what to expect, or what should we be doing as coders to make this process a stream or easy process. So as you can see here, first we must have the right equipment. So when you're doing digital health, as in when you are having an encounter with your healthcare provider, you want to make sure you have the appropriate equipment. And as you can see, I have my laptop as well as my phone. And so this makes it easier for facial communication as well as audio communication. But most importantly, you want to have the audio communication on lock. And so as you can see here, I'm giving you different rooms to be in where you can have those conversations, because that plays a major part in how we select our codes for this service as well. So we're going to be pausing here for a minute just to kind of, not to make you dizzy, so talk about a little bit. So to get started, we will define telehealth or digital services again from a Medicare's perspective. So Medicare defines telehealth services as when a physician or practitioner provides via two-way interactive technology, or telehealth. Telehealth substitutes for an in-person visit and generally involves two-way interactive technology that permits communication between the practitioner and the patient. And I'll leave the link down for you, the MLN from Medicare. So again, Medicare defines telehealth services as a two-way interactive use of technology between a healthcare provider and a patient. So now let's take a look at Medicare's telehealth guidance. So their first guidance is through December 31st of 2024, which is this year. All patients can get telehealth wherever they're located. So as you can see, I'm located here, I'm located there, I'm located everywhere. They don't need to be at an originating site, and there aren't any geographic locations or restrictions. Now, as we move into January 1st of 2025, which is January of next year, for non-behavioral or mental telehealth, there may be originating site requirements and as well as geographic location restrictions. For behavioral or mental telehealth, all patients can continue to get telehealth wherever they are located, with no originating site requirements or geographic location restrictions. Again, this is January 1st, 2025. Now let's define distant site. Distant site is a location where a physician or practitioner provides telehealth services. So again, a distant site is wherever the physician or health practitioner is providing telehealth services, whether that be in their home office or in the clinic or in a hospital or healthcare facility. We would hope that it would be performed in a healthcare facility. But again, according to Medicare distant site definition, a distant site is a location where a physician or practitioner provides telehealth services. So in the beginning, I talked about it being an interactive two-way form of communication, but I never really specified what types of technology. So I'll go ahead and share that information with you. Now, for most non-behavioral or mental health services, you must use two-way. It must be interactive two-way on both ends, the provider as well as the patient. It must be interactive, and it must be an audio-video technology. So the practitioner or the healthcare provider physician must see the patient, and you should be able to see their healthcare provider. Again, that is from Section 4113 of the Consolidated Appropriations Act. Okay, so in 2023 allows you to use audio-only telehealth for some non-behavioral or mental telehealth through December 31st of 2024. So what are some of the 2024 changes as it relates to the telehealth coding? So for those of you who've been in the coding industry for a minute, you will be happy to know that they are delaying the requirement for an in-person visit with a physician or practitioner within 6 months before initiating mental health telehealth services. That's a mouthful, so I'll repeat it. They will be delaying the requirement for an in-person visit with the physician or practitioner. So yes, a coder would literally have to go back to see when was the last in-person visit between the doctor or healthcare provider and the patient. Plus, it has to be within 6 months before initiating mental health telehealth services. And again, at subsequent intervals as the Secretary determines appropriate, as well as similar requirements for RHCs and FQHCs. So again, they are delaying that in-person visit, requirement for the in-person visit, which is great because again, if you're a coder and you've been in this industry for a while and you've been coding digital and telehealth services, yes, this can be a bit tedious and a bit frustrating. So kudos to the delay. And then they are also allowing teaching physicians to use audio or video real-time communications when the resident performs or provides a Medicare telehealth service in all residency training locations through the end of 2024. So again, they will be allowing teaching physicians to communicate with residents as it relates to Medicare telehealth services. And again, this is in all residency training locations through the end of CY 2024. Yes. So in a nutshell, in 2024, they are removing the frequency limitations as it relates to subsequent inpatient visits, subsequent nursing facility visits, as well as critical care consultations. To add to the 2024 telehealth coding guidance, they will be allowing hospitals as well as other providers of physical therapy, occupational therapy, SLP, diabetes self-management training, and medical nutrition therapy services that remain on the Medicare telehealth services list to continue to bill for these services when provided remotely, in the same way they've been doing during the PHE and the remainder of the year of 2023, except that, remember, except means there's a change, there's a pivot. For outpatient hospitals, the patient's homes no longer need to be registered as provider-based entities to allow for hospitals to bill for these services. Again, I'll repeat that. For outpatient hospitals, patients' homes no longer need to be registered as provider-based entities to allow for hospitals to bill for these services. And then the 95 modifier is required on claims from all providers except for the critical access hospitals, electing method 2. Again, the 95 modifier is required on claims from all providers except for critical access hospitals, electing method 2. As soon as hospitals needing to do so, they can update their systems. So if you perform telehealth services through asynchronous telehealth, add telehealth modifier GQ with the professional service CPT code or HCPCS code. You're certifying that you collected and sent the asynchronous medical file at the distance site from a federal telemedicine demonstration conducted in Alaska or Hawaii. The distance site practitioner, billing telehealth under the CAH, which is a critical access hospital, optional payment method 2, must submit institutional claims using the GT modifier. So we have 3 modifiers that we're talking about. We have GQ, GT, and we have modifier 95. So again, the GT is to be used for distance site practitioners billing telehealth under the critical access hospital optional payment method 2. And then they are to use GQ modifier when the telehealth service is performing an asynchronous telehealth. You must assign GQ modifier to a professional service CPT or HCPCS code. Yes, I hope that makes sense. GQ, asynchronous telehealth. You must add it to your professional CPT or HCPCS code. And then modifier GT, when you're a distance site practitioner billing the telehealth services under the Critical Access Health Optional Payment Method 2 systems. So in 2024, to continue billing telehealth claims with the place of service indicator, you'd bill for an in-person visit. Use modifier 95 when the clinician is in the hospital and the patient is in the home, as well as for outpatient therapy services provided via telehealth by qualified physical therapists, occupational therapists, or LSPs, and this is through December 31st of 2024, which is December of this year. After December 31 of 2023, which was last year, and beginning January 1st of 2024, which is this year, we're to use place of service code 202 that represents telehealth to indicate you provided the bill service as a professional telehealth service when the originating site is other than the patient's home. Again, you're to use place of service 02 when you're providing telehealth services from a place that is not the patient's home. Or let me rephrase it. Telehealth to indicate you provided the bill service as a professional telehealth service when the originating site is other than the patient's home. That's 02. Now we're to use place of service 10 for telehealth for services when the patient is in their home. So that is a quick rundown of some of the changes as it applies to digital health and telehealth services in 2024. As you can see, there are some ease up and some delays on some of the requirements that we have been accustomed to utilizing in this telehealth coding realm. Again, I will link the MLN in the comment section so that you can go directly to the source for clarification and your information as a reputable resource. But yes, so hopefully this video provides some insight or at least an overview of how to code or what to expect as it relates to digital health or telehealth services in the year of 2024.